With more than 1,200 physicians on staff in San Diego, Kaiser Permanente takes care of the medical needs of 1 in 5 San Diego County residents. In recent years, new focus on preventing emergencies before they happen has led to a new focus on health maintenance and disease prevention, with the Thrive campaign and anti-smoking programs at the forefront.
We've seen a lot of great results in terms of outcomes. We really explain to patients and we involve them in the understanding of why it's so important not to smoke and how it affects their overall health. And by doing that, not just their primary care doctor, but if they see a dermatologist, an allergist, anyone that they see, will give them a constant reminder that, hey, you really need to think about smoking, you really need to stop smoking and doing everything you can to improve your overall health. I think it's the integration between all of our doctors that really makes a big difference in getting someone to quit smoking.
The Kaiser Permanente staff is a big part of the wellness program.
We do a lot to help our staff. We have what we call Get Fit San Diego, and we have a similar program for our own staff here at Kaiser Permanente, where we work with them to not only not smoke, but also to exercise, eat healthy, lose weight if needed, and really overall try to get them to thrive and be as healthy as we can get them.
Now, Kaiser Permanente is building a 21st century hospital in Kearney Mesa, a LEED Gold certified facility that will use renewable solar energy and offer a new level of patient care.
So our new hospital, it was based on what we call the Big Idea contest that was run with over 150 architects from around America that helped to design what would a hospital of the future have that would allow patients to feel better and recover faster. And it includes things like an over acre-and-a-half healing garden that patients and family will be able to go into. It's also designed so that each floor of the hospital has a microenvironment where you can go outside, and depending on the side of the building it's on, each little garden environment is really designed to capture the particular microclimate of that side of the hospital. So one side, for instance, faces the ocean, has an ocean view, that gets breezes. The other side's a little hotter. And so each one has the different types of plants and environment to make it more of a healing environment for the patient. And that's actually on every single floor and multiple locations of the floor. The exciting thing too is we're gonna have, and I think it's probably the first hospital in San Diego, that'll have a giant interactive screen across from the patient. So basically the entire wall opposite the patient is a giant video screen that'll be controlled remotely by the patient, both by voice and hand motions. And that'll allow them to not only communicate with their family, it'll also allow us as physicians to check on our patients virtually multiple times during the day, check in, see how they're doing, encourage them, and remind them to do whatever particular healing exercise or program that we want them to do. And we can do that more effectively without having to run around the hospital to see them. We can do it multiple times in multiple locations to really encourage our patients to heal more rapidly. So we're doing a lot to really do what we can to incorporate a healing environment to make our patients really get well as quickly as they can.